Very excited. Yes, it's seen quite a growth spurt. When we first started, we would have like 5 to 10 people, and we were just sitting in someone's family room. So it's really nice to see the interest in integrative medicine grow and expand, and see all of your fabulous faces here. So thanks for being here. So again, my name is Davies, and I'm the Director of Alumni Services and Community Education at Pacific College here. I'm also a licensed acupuncturist, massage therapist. And what I like to do for the school is I like to help people find acupuncturists. I can help you find one anywhere around the world, really. And I do a lot of medical and community outreach and education. So I've been doing lots of public speaking lately on integrative medicine, traditional Chinese medicine, and how we can all work together. So basically the structure of our meeting tonight is that each of our panelists are going to have about 10 minutes to speak. And then we'll just open up the floor for questions and answers. And it usually flows really nicely. And we're going to end right at 9 tonight because we want to respect everybody's Friday evening. So let me just let you know some of the things that you have on your chairs. We have a bio sheet, so you have a little information about each of our panelists tonight. And we have the flyer for our next integrative group, which is going to be September, on vaccinations and clearing the controversy. And Daniel gave us an article. There's one article, and then it's also a PowerPoint from Daniel. So you'll see both of those so you know what everything is on your seats. So anyway, 5 years ago, I formed this group after going to UCSD's group. They have something called HIMED, and it's their holistic integrative medical discussion group. And after I had gone to a few meetings, one time I had 40 PCOM students show up at this doctor's house, and they said, Deb, you need to start your own meeting. So hence the formation of this group. The purpose of our group is to educate people on how powerful Eastern and Western medicine can be when we combine it, and also to welcome the growth. And it's really nice to see, like I said, the growth in our group and in the industry itself. The word doctor comes from the Latin word docere, which means to teach. So for me, it's important to teach not only my patients, but other professionals and other people in general about options in their healthcare. So I think that's really important. We have just a few guidelines for tonight. We like to speak in a language that everybody can understand. So if anybody doesn't understand something that's being said, please ask, because we want to make sure that chances are if one person doesn't understand it, then others don't as well. And I actually wanted to do something. I just want to see a show of hands. How many acupuncturists do we have in the house? Okay. And how many acupuncture students or massage students? Okay. How many MDs or Western medical practitioners? Okay. And how many others? I figured there's that. Okay, I just wanted to get an idea, so, you know, for the panelists as well, to know who we're speaking to in the group. And patients? Okay, patients? I think we're all patients of medicine, so we're good. So without further ado, I'm going to introduce our panelists tonight. So next to me, we have Daniel Weber. Daniel came all the way from Australia to be here, so we're very honored to have you. Thank you. Daniel, we're going to clap for him? Okay. He's been around the world. This is fabulous. Thank you. So I'm just going to do brief introductions. Daniel's the Vice Chairman of the Oncology Specialty Committee of the World Federation of Chinese Medicine Societies. He's also an author and is of a special interest on the book Introduction to Integrative Oncology. He also does research, and he's the CEO of Panelist Medicine and a travel speaker. Next, we have Dr. James Sinclair, and James is a surprise guest panelist for people who didn't know. We added him at the last minute for further diversity of different institutions. Dr. Sinclair has been practicing for more than 17 years, and his specialties include hematology and oncology, with a special interest in geriatric oncology. He's also the chairman of the Scripps Cancer Center Committee at Scripps Memorial Hospital in Encinitas. Next to Dr. Sinclair, we have Kim Taylor, who's a licensed acupuncturist. She's a PCOM faculty, and she also created and oversees an integrative oncology rotation for acupuncture students at the San Diego Cancer Center. She's also in our doctorate program, and she recently became part of UCSD's Department for Integrative Medicine with their new Center for Integrative Medicine. And next to Kim, we have Dr. Paul Brenner. He's an MD and Ph.D. physician and counseling psychologist. He's the author of many books, and he's lectured throughout the US, Europe, and Asia on the psychology and health of illness. And last but certainly not least, we have Dr. Dan Vicario. And Dr. Vicario has been in practice in North County since 1994. He's also the co-founder of the San Diego Cancer Center and a co-founder and medical director of the San Diego Cancer Research Institute. So thank you all for being here. We really appreciate your time and expertise. So we're going to start with Daniel. And so just for the sake of time, I'm letting everyone have 10 minutes. I have my Chinese bell. So at 9 minutes, I'll ding, and at 10 minutes, I'll ding, just so we can flow and keep the evening going. So thank you.
Thank you.
Okay.
Good evening.